can't see this in this camera. You know, with the focus of COVID-19, sometimes we forget about all the other medical crises and challenges that people are facing around the world and in this global need for vaccine. A couple of years ago, we had an opportunity to go to Sheba Medical Center and sit with one of its most renowned professors and oncology physicians, Dr. Markel. He joins us live via satellite today from Tel Aviv to talk about his latest. Dr. Markel, welcome to the Armstrong-Williams Show, and thank you for joining us.
Thank you very much, Armstrong, for the invitation. It's a pleasure being here.
You know, it's interesting because up until this point, with stage 4 cancer, only about a third of the people survive, and you've been working on a treatment where you can change those numbers so more people have an opportunity. And while we talk about COVID-19, there's still a serious issue in trying to find a cure for this word that most people don't ever want to hear. It's a C word called cancer. Talk about what you're doing in Tel Aviv in your laboratory, and welcome to the broadcast.
Thank you very much, Armstrong. So essentially what we've been doing, we've been trying to find new ways to reinvigorate the immune system and enable it to operate against the cancer cells of the patient. And essentially what we are trying to do is to focus on a mechanism that the cancer harnesses in order to evade the immune system. And cancer can do it by, can evade the immune system by deceiving through multiple types of mechanisms, but we have been focusing on one untapped mechanism. And the idea is something very, very simple, yet very complicated to deal with, at least until these days. It turns out that cancer cells can secrete receptors or can secrete proteins that mask the ability of the immune system to act against the cancer cells. And the problem so far from a technological aspect was how to neutralize or how to get rid of those proteins that are secreted by the cancer cells. So what we are currently doing is to get rid of those suppressive proteins out of the bloodstream of the patient, and thereby to enable the immune system of the patient himself or herself to operate against the cancer cells. We are alleviating a mask, alleviating a shield of the cancer cells and making them more visible to the immune system. That's essentially what we're doing.
You know, it's interesting because many of us are familiar with the cancer trials, but this is a different world first in what you're talking about. And why is this so different than the trials and the results of the past?
So that's an excellent question. So far, the way that we've been harnessing the immune system with drugs which are called immunotherapies, we've been introducing molecules that can help the immune system to operate against the cancer. But in this technology, we are actually doing it the other way around. We are extracting something from the patient. We're extracting the suppressive proteins secreted by the cancer, and it enables the it should enable the immune system to do its job. So just even from this very fundamental perspective, introducing something or extracting something is something completely different. We are treating cancer patients without giving them any foreign intervention, without introducing any chemicals or any biological aspects or biological molecules. We are taking away something which is suppressive, which is harmful. So that's a very fundamental difference, for example.
I know most Americans are aware of this, that there are already multiple drugs that are capable of sort of harnessing in a patient's immune system that fights this cancer. But these drugs that Dr. Gal Markel, who is the director of oncology at Sheba Medical Center, is talking about, only work around a third of patients. And what's interesting about that is while the remaining 2/3 are left with few treatment options. So what I like for Dr. Markel to do for our audience who this touches directly, indirectly, is this: can you explain, Dr. Markel, how doctors can use a patient's immune system, which you talked about earlier, to fight these cancers?
Okay, so generally speaking, the immune system is a wonderful machine that can identify or recognize cancer cells wherever they are and eradicate them. This is something that is happening all the time in all of us. But for a cancer to appear and to become clinically relevant disease, it must overcome the immune system. And in immunotherapy, what we are essentially doing from a therapeutic perspective, we can do one of several strategies. We can either retrain or reprogram the immune system and retrain it to recognize again the cancer cell that has evaded it, or we can neutralize the different mechanisms that are employed by the cancer cells, and thereby enable the immune system to operate. So this is this is the basic concept. Now comes the different ways of how to do it. And the previous clinical trials have been working essentially on introducing biological molecules that can interfere with this status quo between the interaction between the immune system and the cancer cells, mainly enabling the immune system to either retrain or reprogram itself, or by taking out specific aspects that shield the immune system. In our new trial, it's not only, and this is also something pretty exciting. It's not only that we are taking out something instead of introducing something. It's that the therapeutic platform is completely different. We are treating cancer with a device, with a medical device that enables us to filter out of the patients these inhibitory, problematic, suppressive proteins outside of the patient. So it's a completely new concept of treating cancer with a device instead of drugs. We are taking out something instead of infusing something into the patient. And we think that, that these concepts will enable us to push forward our ability to recruit and harness the immune system for the benefit of cancer patients.
So many people's lives have been touched by cancer for decades and decades. And what is interesting about what Dr. Markel is talking about is that the treatment, this treatment, believe it or not, involves no drugs. And how does this revolutionary blood filtering technology work, Dr. Markel?
So the treatment is based on a device. It's a small tube, and the idea is to run the plasma, that's the liquid, the fluid part of the blood, to run the plasma of the patient through this tube. And once the plasma of the patient runs through the tube, the suppressive proteins, they get stuck, they get trapped, only them, in a very selective way. They get trapped inside the tube, and then the plasma of the patient continue and is returned back to the patient. It's essentially filtration. We are filtering out those suppressive proteins in a very selected way. One could think it's very similar to dialysis. In dialysis, the treatment is based on filtration of the different toxins that are accumulated in the body of patients with kidney problems. So over here, that's a modification of this idea, but instead of getting rid of the toxins, of these toxins, we are getting rid of the cancer proteins. So that's essentially the breakthrough concept of this technology.
You know, this treatment has a connection to the United States because the treatment has already received a breakthrough device designation for stage 4 metastatic cancer from the U.S. Food and Drug Administration. What does that mean to this overall treatment?
So this column itself, or this tube, was developed by a US-based company called Immunicom. They are a San Diego-based company, and the meaning of getting an FDA breakthrough designation means that the regulatory authorities, they recognize the potential of this technology, and essentially they grant it, and it's an expedited process in order to try and shorten the way of the development process, which is required for a technology to get to actual patients. So the meaning of breakthrough designations means that the FDA recognizes the potential of this technology to revolutionize the way that cancer patients are being treated, and is willing to provide it with expedited process.
You know, I must ask you this because we're so grateful to have you on this Saturday, July the 18th edition of the Armstrong-Williams Show. When will this drug be available on a wider scale?
Did you ask where or when?
When will the treatment be available on a wider scale?
So it is. We believe that it will take a couple of years or so, because this is actually the first among the first clinical trials with this technology, and these sort of endeavors typically they do not take a day or two, but rather they typically take many years. But over here, we think that within a handful number of years, 2, 3, maybe something like that, if the results indeed would prove themselves, the technology would become available, and we are focusing our efforts on those cancer patients that have already exhausted the available lines of treatment. So if we will be able indeed to make an impact, it would be on those patients who really have no other way to get treated. And for me, specifically as a physician, I mean, this is really why I get up in the morning, I must tell you, and with the hope that I will be able to be a part of something that will be able to bring hope to other people's lives.
Dr. Gal Markel, it has been a pleasure, and thank you so much for sharing this critical treatment information with our U.S. and international audience. I'm Armstrong-Williams. When we come back, we're going to return to the headline news in the United States from Scott Bolton and Bruce Fein. Don't go away. And welcome back to the broadcast. Bruce Fine, it's always good to see you in this era of COVID-19.
Thank you.
Scott Bolton, it's always a pleasure to see you.
Good to be seen in this era of COVID.
Work is good for the soul.
It is.
It is very good. So, Scott, this would have been, the last couple of weeks would have been when the Democrats would have had their convention, and now that it will not be a convention and the Republicans are having a convention, should Americans make something from that, one having a convention, others not?
I think they should draw that the Democrats at least are more COVID sensitive and smarter in the sense, even if the RNC moves the convention outside in Florida in August, it's going to be uncomfortable for them and probably uncomfortable for most of us watching it. I don't think you're going to draw much from that. The Democrats are going to have a virtual convention. They'll have some live events, and it's the sign of the times. It's COVID. I hope all of them, Republican or Democrats, are safe. But one party listens to the scientists and the doctors and the experts, and one doesn't. And so they can draw that difference.
What ideas do the Democrats have? Every poll indicates that the president is in trouble, that the poll numbers are surging, and every time you turn around, the issue is always the president. We never really talk about what the Democrats will have to offer if they win in November. Bruce.
If I could just retreat first, it does seem to me that if you look at social distancing and COVID-19, the majority in the Senate, which are Republicans, they meet in person. They do social distancing, they vote in person. It's far less risk than those who are on the front line, first responders to COVID-19. Something that they should set the model for others. Don't be reckless, but there are ways. They've got to take risks in life, otherwise we'd all stay in bed. The Republicans, Nancy Pelosi, no, not even showing up. There was vitriol about Congressman Tom Massey when he said, under the Constitution, you need a quorum to do any business at all. And he asked for roll call. Oh, that was terrible. You have to come back and confront the same risks that the nurses and the doctors are confronting every day on COVID-19. And you say, no, you don't want to show up as the Constitution requires and establish a quorum. So I think the Democrats are not setting a model that should inspire others to be prudent, but also if you're leaders, you have to discharge your responsibilities. And if you're a member of Congress, that means showing up for work and being accountable for your vote, not by proxy, but by casting it. Anyway, that's the first observation.
Even at the risk of getting COVID?
Excuse me?
Even at the risk of getting infected by COVID?
That's what the nurses and doctors risk. Do
Firefighters, police officers.
Abandon? You expect them to abandon the front?
I don't expect them to abandon it. What I expect them to do is to operate safely.
Yeah, exactly.
And they're on the front line because they choose to be on the front line, and we need them on the front line.
And you're a member of Congress because you choose to be a member, and their safety standards, in fact, they've shown they work in the Senate.
And if there are other ways that they can vote without showing up, that is safer, what's so wrong with that? I mean,
because the Constitution says that you have to have a quorum showing up physically.
Doesn't say I've got to show up and be infected by COVID, though.
They're the most protected. They have the best care of anybody in the world. Yeah. What are we talking about?
This is ridiculous.
They have security. It's true. What about their responsibility?
Millions of people have COVID.
We're talking about leadership.
We're talking about leadership.
No, we're talking about COVID and leadership, all right? So you want elected officials to put themselves at physical risk to come and vote and do the business
absolutely. That's what
of the government. Hold on.
That's what we do in our military on the front line every day. People die for the freedom of this country.
We have less onerous ways to do it remotely. That makes no sense. Think about what you're saying.
No, the Senate of the United States. The Senate of the United States is doing that.
If I can virtually be there and vote, because none of these opportunities were here during the Constitution, then why not take advantage of that? Why should I get sick and do the people's business when I can do it virtually and still do the people's business?
Because you're setting a model.
You hate
the Constitution
that
says
much?
you're supposed to
you
vote
want them to become ill? It was a question. It wasn't a statement. Do you hate the Democrats so much as you want to infect them with COVID? Then let them. Don't criticize them about doing it virtual. I'm not making excuses.
You're creating a straw man.
Why do you make excuses for
ready today? You ready? You want to get it on today? Okay, let's get it on. Virtually is safer than in person. If our frontline workers could do it virtually and still save lives, I'd be for that too.
The
Why are
Senate-
you all as Republicans
We're not Republicans today.
put
Yeah.
Democrats
we
at
are
risk?
Americans.
We are
And-
Americans
And
today.
how's America
No,
doing with
we're
COVID
Americans.
under this
And
president?
the Senate-
how's America doing with
the
COVID?
Senate-
Not
the-
very well.
the
We're
Senate-
leading this world.
The Senate
in
of the
COVID.
United States does exactly what you're saying is going to wreak havoc on the House. There's not
And how many
any
have been
problem,
infected?
are there?
How many have been infected
They're
with
all
COVID?
showing up there and
How
voting.
many? Several.
Yeah, there are members in the House that are infected, and they're
Exactly.
they're at risk as well.
So why
but
risk
others
it?
have
How come
because they're
safety
leaders,
and health isn't
they're
important
leaders.
to you all? How come it's not important? It should be priority number one. You probably want the kids to go back to school too, right? Get them infected and get us infected.
Yeah.
Get their families infected, right? But they're in school, right? It makes no sense. It's deaf, it's dumb and destructive and dangerous. This COVID policy the GOP is perpetuating. Stop it. Stop it.
Now that we've heard his volume, please continue.
It's called a closing argument.
Volume.
Yes, and what he neglects
To
is
talk
that
about.
anybody, before we get to the Democratic dogmas, is that anybody who's involved in politics, like in law, knows personal interaction, conversations face to face, are a million times more productive than doing things by email.
Virtual.
Yeah, virtual. It doesn't work the same
It's a
way
joke.
at
In
all.
person.
And that is why,
That's
given
in
a
person.
choice, you would have a convention where people showed up because everybody recognized it's a less effective, creating the passions, creating the exchanges. So the idea that virtual is the same as in person is absurd, and nobody lives their life that way.
But it's certainly
nobody
safer,
lives
right?
a life
You would
on
agree
email.
that it's safer that way.
Yes,
Okay.
it'd be safer never to get out of bed too. But there's certain things that you do in life in order, especially if you're a leader, in order to make some kind of progress. Now let's go to the
Let me get this
Democrats.
straight. So if I'm a leader and I'm sick, I should still get out of bed, or if I'm not sick, I should go and risk getting COVID and getting infected so I could be a less effective leader because my health is at risk and I'm either dying or I'm infected. Is that your position?
Would you admit,
That's your
wait, wait.
position.
Would you admit,
Whether you're
before we go to
Democrat or
break,
Republican.
would you admit that they're over politicizing the situation though?
No,
they're
I
really
think the
taking advantage
president-
and exploiting
not the
it.
Democrats.
We're talking about the Democrats
The
now.
president
We always
leads
hear about
this
the president.
effort.
Right now, we're talking about the Democrats, which you don't want to talk about. We've heard enough about the president. We'll get to
I
Trump.
always
Let's
talk
talk about the Democrats.
No, we're not
Are they over politicizing the
it.
situation?
As long as there is an important safety and health risk in this country that manifests itself every day with 50 to 100,000 cases every day, then no. That's not politics. That's health and safety.
We'll be back. I'm Armstrong Williams. Don't go away. And welcome back to the broadcast. I'm Armstrong Williams. Bruce Fine is a constitutional law expert. Scott Bolton, an attorney. You know, we talked about the Democrats. Let's talk about the consequences of the convention and also the president's leadership.
Well, first with regard to the conventions, I think that the conventions are largely there to try to get enthusiasm to turn out the vote. They really aren't there to create new policy here. And insofar as the Democrat convention is going to be virtual, that's going to be a greater challenge because it's difficult to get passionate over a Zoom conference. Who would ever seek to court a lady over email? And turnout, I do think, will be a very important factor in the 2020 election. I think that there's a very, very large percentage of the electorate, and we now know that a strong plurality of registered voters are independent. They're not either Republican or Democrat, something like 42%. And the ability of the conventions to awaken enthusiasm will be critical in determining the 2020 election, not only for the president, but for the House and the Senate.
So Scott, and I think this is a fair question, because I have tremendous
You
respect
never
for you.
ask unfair questions.
Would you think there will be a major revolt from the Democratic Party if Biden doesn't select a woman who happens to be black?
I don't know if there'd be a major revolt because the press to remove Trump is overwhelming in this country.
Well, we're talking about Biden right now.
I understand.
Yes, thank you.
You asked me, did Biden, would there be a revolt? And I don't think that there would be a major revolt, but I also think this, given COVID and given that everything practically is being done virtually, and if you look at the polling, 60, 70, sometimes 80% believe in the virtual platform. More and more people are doing Zoom. They're not
We're
doing
talking
it
about
in
the vice
person.
presidential candidate,
I know,
Scott.
but
That's what I'm
going back
asking
to your
about.
prior
No.
question.
I asked you,
Now,
unless you
in
don't want to talk
regard
about it. I can
no,
understand
do.
if you don't want to
You
talk
keep-
about it.
That's
You're
not
very
a
good as a
theme of
lawyer,
this show.
but just
That's
answer the
not
question for me.
theme. I do not believe it would be a revolt if he didn't pick an African-American woman. To keep his word, he said he wants to pick a woman, right? Now, what the African-American Democratic voter has done for Biden and the DNC and will do for this country, right, by electing a Democratic president, right, there is a lot of work to be done in our communities of color. There are a lot of asks, there are a lot of promises that need to be kept, but we need those promises to be kept, whatever they may be. And so if the vice president, who, no offense, is just a shiny object, if you will, the whole power base of the vice presidency runs through the presidency, then their appointments to the government, there are appointments to the cabinet, there are appointments around this country that could be done with qualified African Americans who just happen to be African American to move this country forward, to have an urban agenda, to do police reform.
So you do have an
and what have
issue
you.
if this is affirmative action?
I didn't use the term
I
affirmative
did.
action.
But you just
It
made an
can't be
argument.
affirmative action.
You don't want this to turn into affirmative action for the VP of the United States.
It never has
Appointed
been
them because they're
affirmative
black. If
action.
you're appointing someone because they're black, that's what it sounds
Yeah,
like.
but that's your narrative. That's not my narrative, nor was it your question. What I said was that if he doesn't appoint an African American
Who's
man or
qualified.
woman who's qualified, that's
right.
not affirmative
I
action.
said, and that's what
they're
you-
qualified. They just happen to be African American.
And we agreed,
right?
but you were too busy talking. You couldn't listen. I said, so you're making a point. You don't want it to become affirmative action.
It never has been. So I disagree with your premise, if you will. That never has been the case. He said he wanted a woman. It makes sense. We've never had a woman who's been vice president. We need someone qualified, and if she happens to be a woman, that's great. He made the commitment. It's a bold commitment, and there are plenty of qualified women in politics, business, and otherwise that could certainly fill that role, lead this country with President Biden or beyond him or with him, without him.
Bruce?
I think that...
To move on, what is it that Trump needs to do to win again?
Well, first,
And do you believe the polls?
I don't believe the polls. I mean, if anything discredits the polls the last time around,
We
you're
can
reading
agree on that.
it's 98,
We certainly agree
97%.
on
That
that.
clearly is not accurate. But I do think that the Democratic Party is a tribalist party. I remember very distinctly your good friend, Clarence Thomas, his nomination to the United States Supreme Court. And by and large, the Democrats said, you're not black because you don't think like us. Those were the basic words. You're not black because you don't think like us.
Isn't that how you processed it? Did someone say that, actually?
Yeah.
Who said that? That you're not black, so therefore you're not qualified?
No, you're not qualified. You don't, that the definition of black was to think like them. The implication being all blacks think alike.
But you're not saying
they don't
someone
have the same
actually
diversity.
said that.
The words to that effect, yes.
Words to that
And they
effect.
said,
remember what
yeah,
Biden said on the Breakfast Club. If you're not, well, I don't want to repeat it, but
Please
it's exactly what he said.
Please, what did he say?
That if you're not black if you don't vote for him.
Okay.
That's what he said. But Bruce, continue.
Yeah,
just to
yeah,
make the point.
yeah.
You're not crazy here today, but go ahead. Okay. Please.
Yeah. I think what Trump's most effective approach here, I think, is the Democrats simply have nothing other than what they're against. They're against him, that's all. They have no positive program other than the old bromides that they've thrown out for the last 50 or 60 years.
Pretty good bromides, and if we ever implemented them, the country wouldn't be in the situation it's in right
and then
now.
there's no reason to think they would implement them under Biden as they were under anyone
we
else.
don't know.
The
We
promises
don't know.
are made and then they're broken. That's what the Democrats do
And the Republicans
time
do
after
the same.
time
That's
after
the problem
time.
with politics
Well,
in this country,
well,
and
okay.
both parties, if you ask me.
See, he agrees.
I do.
And I do think that, in general, people prefer to vote for something rather than just against something. And I think that will be Biden's Achilles heel. You know, he comes out $3 trillion here. He thinks you can just print the money and create it out of thin air. You know, budget deficits do require payments of the interest. If the interest rates, which are now close to zero, on Treasury bills raised to the customary historical average of 3, virtually the entire budget would be paying interest on our national debt, which
Aren't
is
we
now
doing
well
that
over
right
26 trillion.
Under the Republican administration?
Well, the Democrats
doing that
vote
right
for
now?
it, yeah, and it got even faster under Obama. I'm for
Republicans
you got to do
controlled
something.
all three houses. I think.
And the Democrats did too in
that
2010. Yeah.
But it wasn't as bad as this.
You know, I'm going to come back. I'm going to come back with this segment, and then in the last segment, Adam Goodman and Shermichael Singleton will be joining us because this is an important conversation. Because you know, I respect both of these gentlemen, and I do want Scott to talk about the issues with the President of the United States, why his poll numbers are pretty like a roller coaster, and why Americans, many who would have voted for him, who felt that he was doing good things at the beginning, but they feel that he failed miserably during COVID-19, during the protests, and the George Floyd, which was something was obviously murder, in my opinion. I want to speak on that because the president did drop the ball, and we want to be fair and balanced here on this show. We'll be back. Don't go away. And welcome back. You would think that the president, given every opportunity, in the beginning when he was speaking with Dr. Foss and Dr. Carson and others on COVID-19, the issues of retweeting white power, the protest issues in this country, the comments made about military, going to the church with the Bible in his hand. Did he really miss the opportunity? Did he not listen to his advisors? This reveals to us furthermore who he is at this stage in his life, and he just cannot change.
I think it's the latter. We've had 3.5 years of Donald Trump. I don't think it's been a closed book. He certainly doesn't prepare and read his briefings. He said that. He certainly doesn't listen to his advisors. He listens to his advisors. He doesn't heed what his advisors tell him. COVID was a different animal. It wasn't a political issue where you could divide. This was an equal opportunity virus. He was told in January it was coming. If you read back through the litany of tapes of what he said about COVID, whether it was China's fault or whether it was going away or whether hot weather was going to kill it off, you had a real deep misunderstanding of the power of this virus. And we're seeing and paying the price now. Almost ironically, because this president was the jobs president, the economy president, and because he doesn't believe in science, didn't listen to the Fauci and others, withdrew from the World Health Organization, we are now one of the leading, if not the leading, hotspots for COVID in this country. Not first phase, but first and a half phase. Second phase is coming. And those 70 days, that we call them the lost days, where we could have been aggressively attacking this virus and protecting ourselves, the White House failed miserably. It wasn't black, white. This was a health issue, and we're paying for it now. All of the tests that we're doing, all of the accolades that the president speaks on, it's all after the fact because of his failed narrative. In regard to racial justice or injustice in this country, you know, even if the president feels that the police kill more white people than black people, even though black people had a higher percentage, there are two Americas. Blame who you want, but there are two Americas, one black, one white. This was an opportunity for the president to create one America, to console the Floyd family and all the black men who have died at the hands of the police, either illegally or based on racial profiling or just based on racism in these police departments. Reform the police departments, create one America. He has that opportunity. In fact, his numbers with African Americans and brown people in Poland would probably go up if he was empathetic enough, sympathetic enough, and powerful enough to get behind this. Because what those black kids and white kids and brown kids on the front line in these protests, not the anarchists, not the ones that are looting, those who are protesting, they're protesting that this is not their America. And this, for the first time, I see my white brothers and sisters fighting who have not been victimized by racism, saying, we want one America. We stand with you, and we're willing to be more than anti-racist. We want to be anti-racism. And that's why the protesters are out there. That's why the Dems and some Republicans, hopefully, are going to do this police reform bill. But you have got to let go of the handcuffs that police unions around this country have on elected officials. We can get to one America, and we can get to a powerful police force, whether you defund it, which is a bad term, because they don't really want to defund, they just want to refund these community programs. We can get there, but we're going to get there together. Black, white, Democrat, and Republican, because it's a human issue. It's an American issue. It's not a black issue for you and me to lead on.
First, with regard to COVID-19, I think the president's narcissism pushed him into foolishness. This was a health issue. He should have said, this is NIH, and handed it over to the professionals and let them decide. When he made it his issue, then he became responsible. How foolish is that? He's not a health expert. He doesn't know what he's talking about with regard to the dangers of COVID-19. And then he botched it because once it was his baby, he had to make it look like everything was going to be successful. He should have handed it over, and he should do it right now. He says, Dr. Fauci, NIH, they're not infallible, but they're the doctors. They're the specialists. And just like the military people decide the targeting, not the President of the United States in a war. Secondly, with regard to the race issue, first, having lived a long time, there are many whites who were on the Freedom Riders in the 1960s.
Very much so.
They got their heads beaten in. So this isn't the first time that whites have joined with blacks and minorities.
I didn't say it
at
was.
all. But I think that the missed opportunity that Trump had, to reinforce what you're saying, is what Kennedy did in the 1960 campaign when he called the wife of Martin Luther King when he was in jail and voiced sympathy and said, "We're with you." Mr. Trump could call the wife, the family of those who've suffered from police brutality, murder in many cases, and said, "You have my sympathies." Not at 3 o'clock in the morning, but publicly and openly, in order to demonstrate nationally, in the eyes of the Constitution, in the eyes of the government, there's only one race. It's American.
You know, I can't thank both of you enough for joining us. I respected what Scott had to say. It was very reasonable. The president just has this, and he's consistent. He makes everything about him. Whether it's COVID or whatever, it's always about him.
Yeah.
And I agree with Scott. At this stage in his life, it's not going to change. And that's why the election, he's his greatest asset, but he's also his greatest weapon.
Yeah.
It's all on his clock. And we've seen what that clock and how it ticks before, and it continue to tick, and we'll see what happens. But I can't thank both of you enough for joining us. When we come back,
Can I say something? In a very strange way, as a Democrat, right? We talk about we're all Americans. In a strange way, deep down, I often want him to be better. Many of us want him to be better. We wait for the moment, we look at that moment, and we say, okay, this is where he can rise, whether he's reading or not. This is a real opportunity. Go for it, right? Make us all proud as Americans. And he cannot do it. It always goes back to himself. And that's painful for all of us. I mean that. That's painful for all of us. Many of us have given up on him being better. But deep down, all of us just want to be proud of this country and want to be proud of the leadership, even if we disagree with them, whether it was Reagan, Bush 1, Bush 2, or Trump. And he fails every time.
I think all of us just want the president to be normal.
That's a shorter way of saying it.
Yeah,
Right.
and we'll be back with our journalist roundtable, Sir Michael Singleton and Adam Goodman. Thank you again. Don't go away.
Thank you.
Most police officers are trustworthy, but occasionally a bad apple gets hired, which sometimes leads to tragic results. To avoid cases of police misconduct, today's understaffed and under-budgeted law enforcement agencies may need help to more accurately screen job applicants and conduct ongoing monitoring of current personnel. Thanks to recent advancements in credibility assessment technology, this important and complex task can now be more efficiently managed by iDetect. iDetect is the world's first scientifically validated lie detection technology that detects deception in 15 to 30 minutes by analyzing involuntary eye behavior. This fast, accurate, and affordable solution can quickly determine if job applicants or existing personnel have engaged in any type of conduct that violates a law enforcement agency's standards, such as domestic violence or violent crimes. In the case of current personnel, this means disciplinary actions can be promptly enforced. iDetect can also help determine if a job applicant has truthfully reported past disciplinary action taken for any previous police misconduct. In addition, iDetect testing results could become part of the proposed National Police Misconduct Registry database, providing critical information to help assure law enforcement departments hiring officers from another agency have clean work histories. By providing greater oversight and transparency of police behavior to the public, law enforcement agencies can restore and preserve public trust in their police officers. Unlike other credibility assessment solutions, the iDetect test is automated, making it 100% unbiased. Bias in hiring can lead to corrupt decisions and potential discrimination. Law enforcement agencies can be up and running with this advanced technology within days. And with today's viral pandemic, iDetect is capable of testing while keeping a safe social distance. Many law enforcement, military, and security agencies worldwide are already using iDetect to hire more trustworthy personnel.
We're looking to manage a credible process and hire the best possible candidates that we can find. iDetect helps us quickly identify who would make a good police officer and who would cause us a lot of concern. We do not want to have any controversy or crisis going on, and this is one more tool to quickly go through the many candidates that are out there to get the very best. So far, it's been a huge success.
Idaho State Police started using iDetect in 2016. We primarily use it for applicant testing. It's a very standardized test, which means that everybody goes through the same test, they get asked the same questions, so it takes the human factor out of the testing part of that, which I think is very beneficial. We feel like we're getting a very trustworthy applicants who have integrity when they pass iDetect. And it's been a great addition to our agency.
To learn more about how iDetect can help law enforcement agencies with care in hiring and haste in firing, visit Converis.com.
iDetect is a very important new device that's helping hire police officers. It's all about your lying eyes. If there have been character flaws in the past, they're able to weed this out. And so I'm just so glad that this being put in place, given all that's going on with law enforcement officers today. This is a good thing. Find out more about iDetect. So, Michael, the Supreme Court has handed down some provocative cases, and John Roberts is not always, and Neil Gorsuch is not always an ally. As they wanted them to be of the president. Shows that they can be very independent.
I mean, they should be independent, they should be objective, and I never bought into this notion and this idea, Armstrong, that Supreme Court justices, if you're right-leaning, you should only follow some right-leaning doctrine, and the same if you're left-leaning. I think they need to look at every single case individually and decide based on the merits, and I think that's what the Chief Justice did, and I think that's to be expected. But to answer your original premise of your question, that was not a good week last week for the president. I mean, particularly as it pertains to his finances in New York. And I don't think the president is very happy about it. Now, I will say to his benefit, you likely won't see anything coming out of this for the next 6-7 months, so after the election. But at some point, it's an issue the president's going to have to deal with.
And the Supreme also gave weight to continuing federal executions.
Yeah, well, the first federal execution, of course, Armstrong, in 17 years, just took place. Just so everyone understands, the person accused of this and it was accused 24 years ago and convicted of murdering 3 people in cold blood and dumping their bodies in a lake, which included an 8-year-old girl. So the idea that we should have some kind of maybe sympathy for the policy or make it a policy discussion, don't lose the human dimension in this. It was horrible. And there are 3 other executions that are scheduled for the next, I think, couple weeks. All of them involved the murder of children. So in terms of the Supreme Court, and I was listening very carefully to Sherman, I agree with you. Independence of the judiciary, primary. If you look at institutional favor in the country today, the Pew Research Institute always does the institutional index. Do we have confidence in or lack confidence in the following institutions? Only 3 institutions in America are above the cut line, Armstrong. It is small business, it is the military, and believe it or not, the police. And everything else is below the cut line. But in terms of the political establishments and the Supreme Court, the Supreme Court is far and above more trusted in terms of confidence in than any other arm of Congress, the presidency, local leaders, state leaders. That's kind of where we are right now. And all this is playing in a time when we are experiencing a movement. There is clearly a movement.
You know, Shermichael, no matter what we hear about Associate Justice Ruth Bader Ginsburg's health, we know she's not going to die before the November election.
No, I think she has 9 lives. I mean, the lady is pretty impressive, incredible. But you know what's interesting? I never understood why the Obama administration didn't attempt to convince her to retire early, to give him an opportunity early on in his administration to appoint someone who was younger. I never understood that process, because if President Trump wins again, I'm almost certain there's a likelihood that he will be able to appoint maybe 1, maybe even 2 potential justices to the Supreme Court. And I think that's something that obviously if you're a left-leaning, or if you're a liberal, I should say, you would not like that. So I never understood that strategy. But, you know, look, I hope she gets well. I mean, she's well-liked by, you know, individuals on the right and left of the court. They seem to all generally like her. She had a great relationship with Justice Scalia. They were almost best friends, essentially. So, you know, I hope she does well. But the politics of it all is, I know that folks on the right are hoping, not that she passes, but that perhaps she retires to give President Trump an opportunity to nominate someone else.
Adam, will we see an end to Obamacare? I noticed the White House is refiling. Justice Roberts gave him an opening. Is that on his last leg?
I don't think so. I think we're going to press the pedal to the metal. Between now and the election, of course, will determine whether Obamacare in any way, shape, or form is going to survive. But to one thing, Michael, you were saying, and questioning why didn't President Obama maybe look forward in terms of Justice Ginsburg and others. Donald Trump, President Trump, has already hedged the bet. He's appointed over 200 federal, level 3 federal judges. These are lifetimers. And they're also leaning, Armstrong, right now on older judges to consider retirement before the end of the election period so they can renourish and repopulate, you might say, the channel. So whatever happens in the election, if, God forbid, as a Republican, that Donald Trump doesn't win re-election, we lose the Senate, the House continues where it is. The last bastion of the last line for the conservative movement, you might say, the last bastion of defense will be the United States Supreme Court, but it's not a reliable one necessarily, depending on which way the winds are blowing.
How important was the Sessions loss to the president in the most recent election? Sure, Markel.
I mean, look, I think it was important, but I think politically, I think it depends on if you're a voter, what is that tangible 1 or 2 issues for you? And I think within the Republican Party, you sort of have, I don't know, maybe 3 different groups. You have your military folks, you have your more corporatist folks who care about deregulation businesses, and then you have your more religious folks who really care about the courts, federal all the way up to the Supreme Court. And I think for the president, and I don't always agree with a lot of the stuff he does, but if you look at tangible things, there are things that voters can point to, and he can say, I've delivered on these things, and he continues to do that.
Well, the president poll numbers are going up again. You have to study it more to understand what it meant. It's going up again. But I can't thank you and Scott and Bruce Fine and Dr. Gal Markel for joining us in today's show. And thank you always listening. Remember, my Twitter handle is @ARightSide, and my Instagram is @ARightSide. Have a good day.